So yeah, there's something in general now we talk about overactive bladder. And overactive bladder, one of the typical symptoms of that is indeed leakage of urine. So urinary incontinence is sort of black and white in the sense that you're either wet or you're dry, but as to how that occurs and the mechanism responsible for that, that's where we get into more specifics of being able to tackle and address the symptoms and then be able to treat them. So with incontinence, some broad categories that we think about are stress incontinence and urge incontinence. So stress incontinence refers to pressure applied to the bladder and the urethra where there's some mobility and the urine leaks out a little bit, and it's the pressure in the bladder that's not being able to held back by the mechanisms of the urethra, etc., for keeping that in. Overactive bladder is more, you have the urge, you have the feeling like you have to go, and you can't control that urge. And if you don't get to the bathroom in time, the urine is going to start to leak out, or you have a significant fear that that will occur. And a lot of patients indeed actually have both. We talk about, with the bladder, specifically storage symptoms. So how much can you hold? How long can you last between needing to go? Do you have to get up in the middle of the night to go to the bathroom? When you leak, is it because you felt that powerful urge, or is it just that you were wet and you're not sure why that was? And those are the things that the questions that we have to ask to try and differentiate between the different types of leakage that occur. And indeed, there's a great number of patients who actually have both of these symptoms. They have both overactive bladder, which include urgency and frequency, going a lot, getting up at night, but then they also have episodes where bending over, coughing, sneezing, lifting, picking things up, and leakage will occur. And of course, we do our best to try and understand that entire process in order to figure out what the best treatment or modality is going to be, or how to attack that problem in a systematic fashion. So with overactive bladder, we have several different lines of therapy. First line therapy is behavioral modifications as well as dietary intake. So we try and address things that are specifically irritating to the bladder, things that are very acidic or have a lot of potassium in them. So caffeine is one of the things that specifically has direct irritability that we have to talk about. It's such a common thing that people ingest, and to limit that can have a huge impact. So controlling that, even decaffeinated, still has caffeine in it. But we have sort of a list of things that we know about the bladder, juices, especially citrus things, orange juice, grapefruit juice. That acidity that gets into the bladder can be very irritating. Tomatoes is another one, tomato sauce, tomato juice. Some patients, they say, oh, if I have pizza, I'm running to the bathroom. And so if we can just figure out one thing, for example, that is a trigger for a patient, then sometimes that is a huge impact, and I've seen that occur. Behavioral modification just refers to, things that people actually probably already figured out by themselves, things that they know that they need to do to help to avoid leakage. And for some, it's going to the bathroom just more frequently. Others, it's always knowing where the bathroom is. Fluid restriction that people will do as well, just because they feel that if they drink more, then they're going to be, that there's just much more risk of having that leakage. But not everybody's wet. Sometimes it's just urgency, frequency, and they're dry, and then that's really something we treat differently again than compared to leakage or using pads, etc. It's very prevalent. A lot of people consider it, to some degree, something that occurs with aging. It's not uncommon to occur. A lot of people say, well, yes, if my bladder's really full and I pick up something heavy, I'll leak a little bit. But if it becomes distressing, if you limit your activities because of the leakage, then that's the red flag that you really should need to do something. And a lot of people, in fact, they tell me they won't leave their house, or they're afraid to go shopping, and because of these symptoms. And if you have any of these symptoms and you're not sure whether or not you would want to seek treatment for it, that's a good guide, a good rule of thumb in your own head. Am I not doing what I would normally be doing because of these symptoms? And then that's a good, a recommendation probably to consider, at least discussing with your primary care doctor or somebody. After dietary and behavioral modifications, second-line therapies or medications, there are two classes. There's something called anticholinergics and beta-3 agonists, and these are medications that help to either inhibit the contractile nature of the bladder so that it can store more fluid in there between having to go, so that you're trying to control that overactivity. And then the other one is one that really helps to promote storage, so it stimulates the bladder's ability to act as a vessel for storage as opposed to emptying. So we're considering the whole bladder cycle, partially of needing to fill and hold and maintain versus the overactive portion which wants to get the urine out. So some of the medications will specifically try and block that reflex, sort of. Other third-line options for treatment of urinary incontinence include Botox injection into the bladder, which helps to decrease that contractility of some of the muscle fibers. There is InterStim, which is a neurostimulator device that we place that sends a tiny electrical signal directly to the nerves to the bladder. That can be used for both frequency and incontinence as well as retention. So some patients have the difficulty where they're not able to empty all the way, and they can even have leakage with not being able to empty. So there's lots of different sort of permutations that we have to think about and do some objective studies to be able to help with those types of symptoms. With urinary incontinence, there are lots of permutations, and a lot of people are sort of under the mindset that, well, yeah, my mother had this, my parents had this is just something that we're going to have to deal with. It's a part of aging, but it's really not. It's not meant to be, and it's very treatable, and we have many different options. Some people, of course, are afraid of the idea of surgery, but there are so many other things available, and sometimes it really is just simple things such as, making some dietary changes, or some lifestyle modifications that can, get you to a better place where at least you're getting back to doing the things that you want to be doing, because quality of life is the big, thing that we're striving for, improving or maintaining that quality of life.